I am in an unbelievably privileged position, not only standing in this awesome hallway at my awesome office by my, who would be a mentor if I could possibly talk to him, Albert Einstein, because he was a notable genius, but he was also just a great guy apparently. He was a lot of fun and he didn't take himself so seriously that he couldn't enjoy living. And I'm going to invite you to consider something that's very, very different. That you are a genius. Within you, there's a healing potential that probably has never been fully tapped. Because our healthcare system really kind of parents you rather than partners with you. Well, I want to offer you the possibility of partnership. I have a patient. I just want to kind of give you a story because I think it really communicates this idea. I have a patient, she's a wonderful lady. She's roughly around 60 years old. Pretty healthy her whole life, had a few little problems. She went in to get some testing done by a very good friend of mine. He's a cardiologist, he's a brilliant guy. He does great diagnostic work. And she came back from there with some pretty serious concerns. He said there might be some blockage, there might be a spot in her lung. And so she was quite fearful about all the different possibilities. And my job in this is not to cause her to be having more fear. I don't want to push her in the direction of, oh goodness, I want to motivate you through fear. I want to love her into a different place where if she needs to take care of something, I partner with her and I tell her, yes, the calcium score that you had on your heart showed that there's a pretty high risk of having heart disease at some point. What can you do about it? Well, we could throw a ton of drugs at it and say, be very afraid, or we can say, yeah, you're going to need to lose a little weight. We're going to need to change your diet. We're going to need to do these things together. And we're going to get the resources in our community together that she needs to support and encourage her. She needs some counseling, if she needs dietary assistance, whatever it is. All of these things, because you have the healing genius, they're manageable. You can work through them. And the medications and those treatments, either a stent or possibly even surgery, we try to avoid that, but if you need it, it's not the end of the road. You have a tremendous amount of power. You have tremendous healing potential. As long as you're still drawing breath, you can heal. And all of the things that your doctor is going to work with you on should be driven by love. Love for you, love for the way that your body works, and eventually love for the outcome of just a glorious outcome. So don't ever let fear drive you, whether it's Obamacare or a medical intervention that seems just daunting and scary. Get all the information, work with somebody who really has your best interest at heart, who will take you down a natural path of natural healing. And I think you'll get great results. And a complicated case only needs to be complicated as long as it's something that's driven by fear. It can be something that's a great opportunity to see your healing genius go to work. Get with your doctor. We're better together.